Oh, so hopefully you all can see my screen. Um, this is the Alaska site, the coronavirus response. 0 cases yesterday, so that's really cool. Recovered cases are 252 out of 355 total. Hospitalizations hasn't changed, and the number of deaths hasn't changed. Kind of the cool thing is the testing. Now there's a neat site. There we go. So apparently, as of 429, almost 20,000 people have been tested, which is wonderful. And I want to touch on that as well. And if you guys haven't been on this site, these are kind of neat. Basically shows, this deceased line has stayed the same. The blue is recovered people. The yellow is active cases, which is this is that curve that they were watching that has basically flattened and is going down. The other interesting part of this too, which I think maybe is going to alleviate these questions that people have had about everybody's asked about ventilator capacity, beds, like all of these different things. And so this is kind of cool because it does show us, it's really giving kind of a tally in the state. So this is really cool. And this is new too, which is neat. That we can actually see currently, across the whole state, there are 19 COVID positive people or people or persons under investigation. So that's actually kind of neat to see. And, I had just pulled up, I showed you guys this site a long time ago, and I wish I would have kind of tracked the numbers a bit. But this is that NCOV 2019 live site. And I remember, man, this over here on, I guess it's on the left side of my screen, this is over 3 million cases worldwide now. And it was initially, I remember it was like 500,000 or whatever. And it's just fascinating, the numbers that have gone up. And it would be really equally interesting to see this with multiple other, I think, disease states or chronic illnesses and that kind of stuff. It'd be interesting if we had dashboards kind of like this of different things, because this is super informative, but I also don't want it to be something that's scary, because I think it would be equally scary if we had all the flu cases up here as well. But this one's pretty neat. If you haven't checked out this NCOV site, I'd linked to it a while back. It doesn't seem like there's a whole lot. I just kind of had gone through these US cases. You can see we're, clearly way at the bottom. But you can start to see as you go up, like different states. And for whatever reason, there's not a bunch that are changes today that are showing up. Only some of the states have done that. And, New York, of course, is still, fortunately or unfortunately, leading. But this is, it's interesting. I'll be honest, I'm not spending a lot of time looking at these things at this point. I check them once in a while, but it's not changing what I do or what I think during the day. So I've kind of tried to get away from looking at these things, certainly from a standpoint of just not wanting to be stressed about it, for sure. So I will, I'm going to share, I want to share this, and I'm going to actually share this with you guys. And I thought after I sent out that email last night, I should have put this in here, but I'll get it out to you today. But so the Institute for Functional Medicine, I'll share a couple things with you. Is this, no, that's not the, there's a patient, there we go. So I'll share this. There's tips, and we've talked about a bunch of these things in terms of boosting immunity. We kind of talked about some of the lifestyle and behavioral things, and this is really pretty a neat synopsis. The Institute for Functional Medicine does a good job in terms of really just putting out things that we have some data to support. Clearly, we do not have specific data on COVID-19 and coronavirus, but we know what can make a difference with viruses. We also know what things support our immune system. So this is just basic things, behavioral things, which we've talked about lots. We did spend some time talking about those lifestyle things, stress reduction and sleep and movement. And I want to spend a little bit more time today, looking at, nutritious foods that we can look at. Eating lots of fruits and vegetables, super helpful because of flavonoids and all those phytochemicals that are really good in all the different colored things. And the other thing I think we touched on briefly is fermented vegetables. If you tolerate those can be really helpful. We did talk, some about self-care. This kind of goes through sore throats, kind of gargling with salt water. Honey in hot water can make a difference. And we know that there are antimicrobial properties to honey. And then this talks a little bit about things you can do for respiratory and sinus congestion. And then getting into kind of supplements, nutrients, and foods to support immune function. And this kind of parallels this other form here that I will get to you guys today about different things that we can be doing, kind of why they are helpful to us. But going back to, where am I? Not that one, this one. Vitamin C, we know it can help prevent infections. Definitely can reduce duration of colds. It has a natural antihistamine and natural anti-inflammatory properties to it. Vitamin D, that's so important in terms of our hormone health, supporting our immune system. There have been some good articles that have come out, and interesting, the correlation between vitamin D levels and the impact of coronavirus and COVID-19. And we know that people that get sicker tend to have lower vitamin D levels. So taking vitamin D is super helpful. Vitamin A can be helpful in the short term. I'm kind of doing a bit of an experiment on myself right now. I've been taking vitamin A specifically, and what I need to do is just check my level to make sure that it doesn't get too high. I have not done a lot of vitamin A supplementation, certainly over long term, other than a multivitamin, but there is some data boosting it up for a few days can really make a difference in enhancing your immune function. Zinc, we have talked about playing a role in boosting your immunity. Zinc is really imperative in our gut health as well. So zinc definitely can be really helpful. Lozenges, those have been having a lot of trouble finding. And, I frankly have not looked at anywhere locally with regards to those, but we have some zinc capsules here in the office, but I've had, maybe if you guys have been able to find lozenges, that's great, but those have been really hard to find. Selenium we know is a key nutrient for immune function. For those of you with any thyroid dysfunction, we've talked about the role of selenium in thyroid health as well. So thyroid has been shown to be protective against certain strains of the flu, or excuse me, selenium has been. There was a question early on with selenium maybe not boosting too much in your diet because maybe it wouldn't have the desired effect with COVID. And I'm not sure where that's at right now, but certainly getting your baseline amount of selenium is important for immune function. And one of the key sources of selenium that's really easy, as long as you're not allergic, is Brazil nuts. And that's really eating like 2 or 3 Brazil nuts a day, and you would get your adequate dose of selenium. Most multivitamins, that's a multivitamin, multimineral, will have selenium in them as well. Honey is good. It is actually antimicrobial and can help for cough and sore throats. Garlic is really good as long as you tolerate garlic. One of the key things with garlic, I think a lot of us were taught if we're cooking garlic to throw that in right away and really cook it. And really what we should do is if you're adding garlic to a recipe, add garlic at the end, because you don't want to overcook garlic because you're going to basically cook out the benefit from it. So Adding garlic kind of at the end is really great. If you can do raw garlic, awesome, because that definitely can help in terms of viruses and reducing severity. So probiotics, that's where kind of those fermented foods come in. This is all about our gut function, which really influences our immune system, because 70% of our immune system's in our gut. And getting back to this other, so this talks a little bit more about key, really on nutraceuticals. Let's see, is curcumin. A lot of you are aware of curcumin or turmeric. That the nice thing about this chart that the IFM has done a really good job kind of just explaining, like, well, what are the potential benefits, and then they've broken things down to enhancing immune system or decreasing viral growth, reducing symptoms. So I think it's kind of nice and helpful for people. You all know that I like to explain why things are helpful, because I just feel like if we have a better understanding, then we're more likely to make positive changes for ourselves. So curcumin is something that I've talked about for a long time and I really like. Quercetin can be really helpful. Quercetin is found in fruits and vegetables, like it's in onions, it's in the skin of apples. So that can be an issue for those of people with birch allergies. But taking quercetin is also what's called a zinc ionophore, so it actually helps get zinc into your cells. And so quercetin can be helpful. I use it a lot with people with allergies, because it basically, when we are exposed to allergens via food or aerosolized allergens, when people get spring allergies, we breathe something in, our body kind of responds, and these little mast cells in our body, which is part of our immune system, they, for a lack of a better word, they kind of blow up and they spew out the histamine and bradykinins and these different things, which causes us to cough and have a runny nose and itchy eyes and sneezing and all of those things. Well, and we typically give somebody an antihistamine, which helps quell those symptoms a little bit, but like a medication like Singulair, quercetin will work. It actually stabilizes that mast cell so you don't get the histamine release. So it kind of works a step back. And for a lot of people, it can be really helpful, and it's not sedating and some of the others, adverse effects of taking an antihistamine. This talks about zinc. The neat thing this gives, like, kind of regular dosing of things that is safe in general for people. And this is not suggesting taking high doses of anything. Zinc, though, lots of antiviral properties. It's really key in our gut health. N-acetylcysteine is a supplement that I've used for a while. It helps promote the production of glutathione, which is it's kind of our master antioxidant in our body. And so that helps support immune function. And when we get sick or injured, we basically have what's called oxidative stress. And so we need antioxidants to help quell that so we don't have more cellular damage. But vitamin C also helps. But NAC is a nice thing. There are many of you that know about glutathione, and glutathione is great. Glutathione is expensive, and in some cases it's needed, but a lot of times supporting with N-acetylcysteine will help. A couple of other interesting tidbits about N-acetylcysteine. Years ago, there was a study done, and it reduced the duration of the flu, so our common flu. The other thing N-acetylcysteine is utilized for, certainly in the hospital setting, is in aspirin and Tylenol overdoses. So it's a good liver support. So that was something that I'd learned about that long ago, but didn't really fully understand probably the mechanism of why this worked and did what it did. And I, at the time, did not know really much of anything about N-acetylcysteine. Vitamin D, this definitely enhances immune system function, reduces viral growth, can reduce upper respiratory infections. We know that people with higher levels of vitamin D tend to be less likely to get sick, which is great. So vitamin A, this is what I was telling you about too. It's anti-inflammatory. It enhances immune function, supports the lining of our respiratory tract. The other interesting thing about vitamin A, so when we're talking about like these measles outbreaks in countries where there's undernourished children and people in general, pre-treating those folks with 200,000 international units of vitamin A for just a few days can actually reduce the risk and spread of those common kind of childhood viruses. And from a public health standpoint, that's actually a pretty cheap and effective thing to do, but I don't know that that is being widespread done. So, I mean, it has helped pique my interest more in vitamin A and what is the appropriate rule and, you know, amount. So if you're on a multivitamin, multimineral, again, you're probably getting an adequate amount in your, you know, with that daily dosing. Vitamin C, I would say 1 to 3 grams daily. I probably take 2 to 4 grams daily. This, many of you, if you're keeping on top of this at all, even on social media, you're seeing that it's been used in intensive care units. It was used in China. It's been used in all over Europe, Italy. Some of the hospitals in New York are using it, and it is helping some of these people that are more ill. Another supplement that I think we don't think about too much in terms of inflammation and our immune system is melatonin. And melatonin, in addition to helping people sleep, certainly some people don't tolerate it, so I wouldn't push it then. But at higher doses, 5 to 20 milligrams, really can help support your immune system and reduce inflammation. Elderberry, there's been lots of conflicting data. I'm not seeing it so much now, but it really was in the beginning, and this concern about the cytokine storm. That really, I think, is only happening in vitro, so in a test tube, versus in vivo in human body. We don't have that data to support that that's happening. So elderberry is great. I don't tend to take it daily. I'll take it if I need to take it. PEA is an anti-inflammatory agent, and this can actually help in terms of acute respiratory disease, the flu. We can extrapolate from that, if as it's an anti-inflammatory, is that going to potentially help with COVID or any of these other things because of the anti-inflammatory properties and what's we're seeing happen with coronavirus. Green tea, this is another one that I think that flies under the radar. It's used a lot in oncology, enhances the immune system, and it, you know, if you like it, it's really good for you. It's not generally high caffeine and can really be a helpful thing whether you drink it or take a supplement. And lastly, you know, and this certainly isn't an entirely inclusive list. There's lots of other stuff, but resveratrol is another thing. And resveratrol you've probably heard of, you know, that's in grapes or in wine. And resveratrol can actually be helpful in terms of basically as an antiviral. It also is a good antioxidant for us as well. So that's a bit like in terms of diet and supplement suggestions. And then one other thing I wanted to talk to everybody about a little bit, because we're getting more discussion about testing. And so I participated in a webinar the other day on what is available in current testing, where are we at with this. And I think that this is really helpful, you know. So right now there's kind of two tests that we're doing. We're doing that PCR test, which we talked about, which is really looking at this viral RNA. And then there's also viral cultures, which aren't done very often with this, but then there's also antibody testing. And this is that idea of like, have we already had it, or do we presumably have immunity? There's lots of interesting things here, but very interesting is like when you see on this left axis is kind of percentage of positive patients versus time after onset of symptoms. So here is day 0 of symptoms. This is when you first get an onset of symptoms. So, you know, this is kind of the viral load. You're looking at like 40%. You can see how it peaks, you know, kind of between days 3 and 7. And then really, I mean, it doesn't logarithmically drop off, but it really drops off. So this whole idea of like, well, when should I get a test done? And we're talking about testing asymptomatic people, you know, and we don't know, you know, does this logarithmically go up here? So in that case, if we're testing asymptomatic people, we're probably missing, number one, they just don't have enough viral RNA. So, you know, to me, and I'm not the researcher behind this, but I mean, that begs to me when we talk about asymptomatic spread, is it possible? Absolutely. Like, but it will be interesting when we get through this all, like how much is that playing a role? Because if you don't have very much viral load, you don't have symptoms. And then I would think, when I just think it through, like if you don't have very much virus, how easy is it to pass it to somebody? So that's just me thinking out loud. But you can also see when we get beyond kind of a week, there's this could drop off. So if you go in here, day 2, get tested, negative. You could go in here like a week out, week and a half out, totally could have COVID, do the test, could be negative. The other issue is that sample, which we talked about, and you know, they've got to shove that little swab way up your nose to the point that your eyes are watering and it's very uncomfortable. So the collection really is impacting, you know, maybe our ability to get positive results. So there's so many variables really. And then now we're talking about doing antibody testing, and you can really see, you know, here's 2 weeks. So it's really taking at least 2 weeks until we start to develop antibodies. So if somebody tries to do antibody testing earlier on, might be negative, I would say it doesn't really say for sure that you haven't been exposed, because maybe you haven't produced antibodies yet, but also maybe you're not going to produce antibodies. And so we don't know right now how many of us produce antibodies versus how many won't. And there's this talk about like immune passports. And right now I'd say like we don't really have good data to say that would even be helpful. And we don't know for sure if you get antibodies, does that mean you don't get this? So still lots of variables, but I thought that this was really helpful. And I think I can download a PDF so that you can see this, because to me, this being able to see this visually really helps to understand like why some of the testing, you know, we don't get the answers that we want to get, but this is why. I mean, and this is just the nature of a virus, and it's the nature of our immune system. So that's something that I can share with you guys. One other thing that I learned on whatever day, Monday or Tuesday, when I did this webinar through the Institute for Functional Medicine, they're working on another test. They're working on lots of other tests, but kind of a cool test is they're going to work on one that's using total antibodies, but it also would come from a saliva test. And if any of you caught the radio program this morning, that Mike and I had a little chat on Big Cabbage Radio, we talked about this saliva testing, because during the night, when you think about it, you know, you have the little cilia that work in your nose, and it kind of pushes stuff down so you get junk in your throat. Those same cilia pull things up from your lungs. So like in the morning then, you know, certainly think about allergy season, or if you're sick, you know, in the morning you're sick and you got to cough stuff up or you're spitting or whatever. But if we could utilize there's the thought that having that first kind of morning sputum saliva sample, that may end up be, you know, being really helpful in terms of testing. And that would be really cool if we could get to that, because we forego this, you know, really uncomfortable test with a swab way up your nose. And, you know, we also eliminate if it's not done right, all of those things. And so I think, you know, the things that are happening in testing are happening so rapidly that we just got to kind of keep an eye on the forefront of what all is happening with it. So that, otherwise, I think is about that's kind of what I have today, like, to say. So